Hi, and welcome back. If you are new, my name is Connie, a RRT, and I want to help you pass the TMC. This TMC review is based on the 4 life functions, their priority of order, and how they will help you choose the correct answer. As you get to know me, you will see I like to get to the point. Just like when you read a question from an exam, get rid of the fluff and get to the point of the question. Focus on what the question is asking you. In my first video, I discussed what resources I use to study for the TMC, and one of those was Kettering Seminars. So today's video is based off of what I learned from Kettering Seminars. Just a portion. There's a lot more. Okay, let's go. Okay, so you learned this, or one of your first lectures in respiratory therapy school, you're going to learn this. Or you did, and if you take Kettering Seminars, you're going to learn this as well in the very beginning. The 4 life functions in this order: ventilation, oxygenation, circulation, perfusion, ventilation, the movement of air, oxygenation, oxygen into the blood, circulation, the movement of blood through the body, perfusion, blood pressure, urine output, hemodynamics, and the movement of oxygen into the tissue. Always in this order. So if you have to choose an answer based on the 4 life functions, ventilation is always number 1, because if you're not moving air, eventually you're doing none of the rest. Almost every assessment relates to one of these life functions. Oxygenation is the function most often seen as an issue or on a test question. If you get stuck with a question on the TMC, think of these 4 life functions and their priority of order. Just a small review of fluid balance and hemodynamics. As I was taught in Kettering Seminars, this isn't all of it, it's just a portion, but to the point. Intake and output. Normal urine output is 30 to 40 ml an hour, roughly 1 liter in a 24-hour period. If intake exceeds output, this could result in weight gain, electrolyte imbalance, increased hemodynamic pressures, decreased lung compliance. CVP, or central venous pressure, can shift hemodynamics. Normal CVP, 2 to 6 millimeters of mercury. Anything below 2 could result in hypovolemia. Anything above 6 millimeters of mercury can result in hypervolemia, needing our help, such as Lasix, furosemide, diuretics. Okay, so keep those in mind. Just a quick review based on Kettering Seminars. Normal vital signs. We know the normal, but what you're looking for as far as respiratory rate, anything below 8 breaths per minute, anything above 20 breaths per minute, unsafe, unacceptable. Blood pressure, acceptable range, 90 over 60 to 140 over 90 millimeters of mercury. Anything below, anything above, not safe. And we know how to get your MAP by dividing 120 by 80. That is the average MAP. We're not going to talk about that right now. Anyway, just in case. Heart rate, 60 to 100. We know anything below, anything above, not safe, should get your attention. Okay, based on that real quick information and review, here are 5 TMC style questions similar to what you will see in the practice exams, which I mentioned in my first video, you should always be doing, and the real exam. Okay, everything to get you to the TMC. Okay, let's, before we move on, the 20 rule. I want you to think about 20 points, 20 points above normal. Anything 20 points above normal should always get your attention. So we're talking about respiratory rate, heart rate, anything above 20 should get your attention. And you'll see there's going to be a question in here that's going to have that, and it's going to get our attention. Okay, question number 1. A 36-year-old patient underwent laparoscopic cholecystectomy, which is a gallbladder removal. The patient is receiving supplemental oxygen through a nasal cannula at 2 liters a minute. What is the most appropriate method for a RT to evaluate the patient's response to O2 therapy? The correct answer is measure the SpO2. The question is asking about oxygenation, and checking the SpO2 is quick and reliable. Question number 2. What is essential to ensure adequate oxygenation and ventilation of a patient during a ventilator circuit change? The correct answer: manually ventilate the patient while changing the circuit. Okay, let's break it down. Why is that the correct answer? Ventilation is the priority, okay? And manual ventilation is the best choice. The patient still requires mechanical ventilation. You didn't take them off the ventilator. They need to be on it. You're changing the circuit per your facility policy. Time to change the circuit. Patient still needs to be on that ventilator. But when you're changing the circuit, they can't be on the ventilator, so someone has to ventilate the patient. So during the circuit change, RT must provide ventilation. Question number 3. During nasotracheal suctioning, a patient's heart rate increases from 90 to 125 beats a minute, and the SpO2 decreases by 94% to 88%. The RT should alter the correct answer is suctioning duration. How long are you applying suction? That is the correct answer. Why? Why is that the correct answer? Okay, going back to the 20-point rule, look at the heart rate. It went from 90, which is unacceptable, all the way up to 125. That's a difference of 35 beats a minute. That's past 20. So that should get your attention. Circulation is the question. NT suction should not last more than 15 seconds with each pass. While you're applying NT suction, you always monitor the reaction and tolerance. If they're not, then you need to stop. Maybe you only need to do 10 seconds, but the correct answer is changing or altering the suction duration. Question number 4. A patient with a history of hypertension was awakened by a cough and shortness of breath. He has fine inspiratory crackles bilaterally. Which of the following should a respiratory therapist recommend? The correct answer: furosemide Lasix. This is a perfusion question. Let's break it down. Patient has a history of hypertension. They show signs of nocturnal dyspnea with bilateral fine crackles, which are all indications of CHF, okay? And we know one of the things that can help a patient with CHF is Lasix. Sorry, friend, we're going to give you Lasix. You're going to get up in the middle of the night to go to the bathroom, but at least you're not coughing. Okay. Question number 5. A respiratory therapist returns to the room of a 63-year-old female patient and finds her less responsive. The patient has a heart rate of 154, respiratory rate of 8, and a weak pulse. She is currently receiving oxygen at 2 liters a minute, nasal cannula. The therapist should first, the correct answer is activate the medical emergency team. Okay, so let's break it down. Does it matter that she's 63 years old? No, but what matters? She's less responsive. And how do you know? Because you were there previous. You came back and you're like, hey, she's not responding the same. That's your first. Her heart rate has gone up to 154. That's your next clue. And respiratory rate is 8. And her pulse is weak. She's got all classic signs that she needs your attention. You're going to ask for help because you're the only one in the room. And she might need more than just one person in the room to lay some eyes on her. So you're going to activate the medical emergency team. This is a combo ventilation circulation question. And look for those keywords. What is going to be your initial intervention? You're going to ask for help. Activate the medical emergency team. Okay, so let's summarize. If you watch my first video, then you know how I feel about changing your answer. Don't do it. I think every video from the first one that I made and every video after is going to have that one somewhere in that video. I am going to keep hounding that and saying that because it is the number one sin that we all commit. I did it. I've done it myself. In an exam, oh, let me change my answer. No, my friends, don't change your answer. Okay, so let's review a little bit. Review the rationale behind the answer. So we're not memorizing answers. We are understanding why it is the correct answer. If you understand the why, you're going to click through those questions a lot faster. This may help you navigate through the exam, feel more confident listening to your gut, and feel more confident with test taking. And we never change our answer. Okay, that's it for this video. Thank you for watching. I hope this video was helpful. Like and subscribe. I will see you in the next video with more TMC review. Bye.